The next question, anonymous. I have stage 3 endometriosis and have been told that my fallopian tubes have extensive muscular dysfunction. Is it caused by endo? Can it be improved if I remove the fallopian tube? So we have very good data, we have very good research to show that when your fallopian tubes are filled with fluid, in case of endometriosis, that can sometimes be blood, that's called hematosalpinx. Then for those who wish to go for IVF, that's definitely the right thing to do, removal of the fallopian tubes. I speak to all my patients about the fate of their fallopian tube when I do surgery on them, whether or not they have any fertility wishes. And I will expand on that a little bit. So let's talk about fallopian tubes just for a second in a few different scenarios. Those who have hematosalpinx or hydrosalpinx, that means that their fallopian tube, one or both, is not functional because there is an accumulation of blood or fluid inside the fallopian tube. And those patients would usually benefit from removal of these fallopian tubes before they go for IVF. They are not working anyway, so leaving them behind will not do them any service, but removing them can potentially double the success rate of IVF. So definitely talk to your surgeon before going for surgery what you wish to do if he finds at the time of the operation that your fallopian tube, one or both of them, are affected by the disease. The other scenario that is probably worth mentioning is the finding that a very large proportion of patients who present with ovarian cancer, in fact, the cancer has originated from the fallopian tube. This is something that the Canadian group found out around 10 years ago, maybe slightly more than that, and that has now become usual practice during a hysterectomy, that in the past we didn't necessarily remove fallopian tubes when we did a hysterectomy and wanted to leave the ovaries behind. Now we always do that, we always remove the fallopian tubes. But even when we are not doing a hysterectomy, if somebody is certain they've completed their family, let's say they have had sterilization already and they are absolutely certain that they don't want more children, then we always talk about removing their fallopian tubes even if they're normal, if we are doing surgery for another reason. Now this is slightly less routine, if you like, so not every surgeon does this, but in my opinion, removal of the fallopian tube as a cancer reduction procedure is something that can be considered and discussed. The evidence is not still 100%, is not there, but I think there is a point in doing that.